This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. A key economic indicator out Thursday reveals American consumers are still getting pummeled by high prices despite historic rate hikes by the Federal Reserve to try to keep inflation in check. The prices of everyday goods and services continue to soar, impacting Americans' wallets and financial security. And although new actions from the Social Security Administration could boost the spending power for benefit recipients, it may not be enough as consumers continue to feel the crunch. A new report out Thursday from the Bureau of Labor Statistics is revealing something most Americans already know. The prices of consumer goods and services are still surging, and people are feeling the pain everywhere, from the supermarket checkout to the doctor's office.
It's not just disappointing, it's actually damaging for households in the sense that their buying power has been robbed by inflation.
Data from September's Consumer Price Index came in hotter than expected, showing inflation rising 8.2% last month compared to a year earlier. That means despite September's lower gas prices and aggressive actions from the Federal Reserve, which take time to have a pronounced effect, just about everything got more expensive.
The major contributors to this rising inflation in the latest reading include many things that we cannot do without. This includes food, shelter, a measure basically of rent or what we're paying with our house payments, as well as medical care.
In response to the exploding cost of living, the Social Security Administration announced an 8.7% boost in monthly payments beginning next year, the largest increase in more than 40 years. But some analysts say this still won't be enough to help the 70 million benefits recipients weather the financial storm.
I am concerned, however, that doesn't quite keep pace with inflation or the real costs that many people have to pay when we're thinking about shelter, heating costs, and medical care and prescription drugs.
Concerning numbers indeed. And as we round out the week, COVID-19 cases remain steady in the USVI and continue to decline. There are currently just 39 active COVID cases territory-wide, with 25 on St. Croix, 12 on St. Thomas, and 2 active cases right now on St. John. And a new study warns Paxlovid, an oral antiviral COVID treatment, can negatively interact with common heart medications. The review paper says interactions between Paxlovid and certain blood thinners can cause an increased risk of bleeding. Certain cholesterol medications can be toxic to the liver, and interactions with certain blood pressure medications could cause low blood pressure, flushing, and swelling. An expert not involved in the study says in the case of drugs you should not stop taking, the doctor will have to do a risk-benefit analysis on taking Paxlovid. New evidence of the impact school shutdowns had during the pandemic. The national average ACT scores for high school class of 2022 has declined to its lowest level in more than 30 years. The average came in at 19.8, the lowest in more than 3 decades, according to data released by the ACT, the nonprofit organization that administers the college readiness exam. This average is half a point lower than the 20.3 scores in 2021. The score marks the first time since 1991 the average ACT composite score was below 20, with 2022 being the 5th consecutive year of decline in average scores as well. Findings from the ACT also show that scores have continued to decline during the pandemic, and these declines have returned student achievement to levels last observed again in the early 1990s. As we reported, the NFL updated its concussion protocol after several recent head injuries. Now, the safety spotlight is shining on high school football teams and how student athletes can be better protected on the field. Mandy Gaither has more in a new study that suggests scaling back drills during football practice may help.
A lot of head impacts are occurring during practice, not just the games. Numbers kind of astounded me. So 74 players a season, they looked at 7,300 head impacts. So it's close to 100 impacts per player on average. That's a lot of head impacts on these high school football players. And it's not just concussions, it is these subconcussive or just head impacts of any sort. They accumulate over time. We know more than ever that some of these chronic changes, some of these most concerning changes in the brain can start early.
And researchers say most of the head hits were to linemen. After that, tight ends were most likely to have head injuries, followed by running backs and quarterbacks, according to the study. The FDA says right now there's a shortage of the attention deficit hyperactivity drug Adderall. According to the agency's drug shortages page, back orders for several generic forms of the drug are expected to last into March. There's also a back order on one name brand dosage, which is expected to be resolved this month. Manufacturing delays by that pharmaceutical company is to blame for the delay on that one. Other manufacturers are producing, but they don't have enough supply to continue to meet the U.S. market demand. The FDA recommends consumers talk with their healthcare providers about other treatment options out there. October is Hispanic Heritage Month, and health experts are pushing diabetes prevention. Research shows Hispanics are more likely to develop type 2 diabetes than non-Hispanic whites. Deborah Alfarone shows us how healthcare providers are helping one Hispanic community lower their risk and prevent the disease.
Inside Tyler Heights Elementary School in Annapolis, Maryland, these women are dancing to try to lower their risk of developing diabetes.
Latinos are just genetically more likely to get diabetes. You have social determinants of health, which is key. Access to healthy foods, access to being able to go out and exercise.
Community health provider Alexa Moran runs this diabetes prevention program for Luminous Health. It's funded by a 2-year grant from the state. She also educates this group about making healthier food choices. Ana Racino says she's learned it's healthier to eat whole grain rice. Moran says the idea for the program came to her while managing a pop-up vaccine clinic during the pandemic.
It created an opportunity to ask those people, what do you need? What are you looking for? And to really see all of that they were struggling with, like no meds, no access to health care, and all of these other social determinants of health that really became apparent.
For 400 years, we've been at this work, right? And disparities still exist. We have to be intentional and deliberate in acknowledging those differences and making that a part of the way that we deliver care.
Taking a step closer towards prevention while embracing their unique needs. Deborah Alfarone, CBS News, Annapolis, Maryland.
And with the help of an $8 billion push by the Biden administration focused on nutrition, the National Hispanic Medical Association is continuing to educate health professionals on health diet plans, and the YMCA is expanding its diabetes prevention program to dozens of communities across the country as well.